Hello everyone. I'm so delighted to be with you today and to talk about how to be an engaged patient, how to be an empowered partner with your healthcare team. I've come across this wisdom by trial by fire. I have a very colorful health history. I've had cancer 3 times, hepatitis C, various other things, gluten insensitivity. So I have a lot of experience as a patient. On the flip side of that, I also am a healthcare provider myself. I've been married to a physician for 40 years. We have 3 sons who are physicians, and their wives are all healthcare providers. So I've seen both sides of the fence, and I'd like to share with you some of my hard-earned wisdom. I think that things have changed since what it used to be of days of war where the doctor always knows best. Now we know what our bodies need, and we know what it is that we want from the healthcare team. So this is a really good time, an exciting time to be alive, to be here, to be fully present. And so let's work together today to make healthcare the best that it can be, because we know that by having good communication among all members of the healthcare team, medical error drops dramatically, and we all want that. We all want what's best for the patient. So being an empowered patient, being a very active partner with your healthcare team is important and only has benefits for everybody involved. So what do we do? Let's talk about before you go to see the doctor, before your appointment. What do you need to do? So be prepared. That's the main thing. Be prepared. Get together all of your medications, maybe even brown bag them, put them all in a bag, so that you can take that knowledge to your appointment, so that your healthcare team, everyone is on board and knows what it is that you have been taking, you are taking. Also include in that any over-the-counter medications that you're taking, and any herbal supplements, any dietary supplements, that sort of thing. This information will be put into the electronic medical records, and then you don't have to do that every time that you come. Of course, you'll have to update, but you won't have to start from scratch. So this is especially important if you're seeing a physician for the first time, or if you're changing physicians and there's nothing in, starting from scratch, there's nothing in your electronic medical records. We know that it's really important also to bring an advocate with you, another set of eyes and ears, someone else who can take the information in, because there may be a lot, and it's just really important to have that other brain working. And also that's another person who can take information in, but another person who can speak up for you if you forget something, if you feel overwhelmed, if you aren't sure how to phrase a question. That advocate is very important. And when you get home, you and your advocate can talk things over, because 2 different people can hear the same information 2 different ways. So if that's the case, then you will call and get a clarification. It's just always good to have another set of eyes and ears with you. When you are compiling your questions and doing your research beforehand, be a little careful about the kinds of websites that you are using and the kinds of sources of information that you are gathering. Use websites that have been created perhaps by academic centers, and or websites that have been created for disease specificity, for a particular disease. So I'd like to share with you an app that I have found extremely helpful with my own medical visits. It's called the AHRQ Question Builder app. The AHRQ is the Agency for Healthcare Research and Quality. It's a governmental agency, and it is charged with improving healthcare. And so this Question Builder app helps you collect all of your medical data. It helps you find resources, and it puts it all in one place. And it also will give you prompts for the kinds of questions that you might want to ask your healthcare team. It is very helpful that that information is only then stored on your phone or your electronic device. It is not out there in the web. Once you get all of this together, you will either email that to yourself or put it in the calendar, your calendar on your phone, so that when you get to the appointment, you just opened up that calendar item. You do need to have a smartphone, and you will go to your app store or wherever it is that you download apps, and you will download that app. You set it up ahead of time. You put in your name, pertinent history. It will ask you some questions, such as, for an example, are you seeing the doctor today because of pain? And if you check yes, then it will give you a drop-down menu of some other questions. Is the pain long-term or recent? And you answer that. And is the pain sharp stabbing or dull throbbing? And you answer that. So it helps you put together some answers to the questions that your physician might ask you. And in addition, it helps you put together some questions that you might want to ask your physicians. So it's all evidence-based questions, and it's available at no charge. And so it's very helpful. It's also helpful that you can take a photo of your insurance card, so you don't have to fumble around trying to find your insurance card. You might want to take a picture of a rash, for example, so that you have that. It also will provide you some access to consumer information about disease-specific conditions. So I highly recommend it. Again, it's called the AHRQ Question Builder app. So during your appointment, you will review those medications that you've brown bagged along with you. Be sure to report if you have discontinued a medication, or if you have restarted one, or if you've experimented with a dose, or if you found that you have had a reaction to a particular medication. Also be sure that you report any non-traditional treatments. If you are seeing an herbalist, if you are doing a particular kind of yoga practice, if you are seeing a chiropractor, if you are taking a nutritional supplement, those sorts of things are important for your healthcare team to know about as well. So the message here is that we need to be very well prepared so that we can provide information to the healthcare team in a succinct and concise manner. We want to be respectful of their time. We want to give them everything they need to know, but we want to give it in a succinct, concise manner. Don't ramble on and on about something that is, perhaps not important right at this time. Be prepared with thoughtful, informed questions. Now, your healthcare team will welcome those questions. They'll welcome that research that you have done in a thoughtful manner. And that, we're all in this together. We're all partners. So they will welcome those questions and research articles that you've brought. Again, as I've said, gone is the days where we always believe that the doctor always knows best and there's no asking any questions. We are working together now. We are a team. Now, be prepared for some difficult conversations. These conversations are important. There are conversations that are difficult because they're difficult questions to ask. Questions like, did you wash your hands before you touched me? Is this a new needle, a new syringe that's only for me and will never be used again? And what else are you doing to make me safe, keep things safe for me? Those are difficult questions to ask because there's perhaps a hint of distrust, perhaps, or perhaps a hint of uncertainty. But those are important questions to ask because I did not ask, is this a new needle, a new syringe, and it will be used for me and me only? During chemotherapy for breast cancer 20 years ago, I contracted hepatitis C, and 98 other Nebraskans contracted hepatitis C because the nurse was reusing syringes during administration of chemotherapy. There's also difficult answers to hear, but those again are very important to ask those questions. Questions like, what's my prognosis? What happens if I don't do this treatment? What's my quality of life? Again, that's really important to ask that. When the oncologist said to me, you have sarcoma of the right brachial plexus, and the treatment is amputation of your right arm and shoulder, I was dumbfounded. But I had to ask, what if I don't do this? What will happen? And then I got the answer, well, we'll try to keep you comfortable as long as we can, and you might have a couple of years. As difficult as that was to hear, that was really important information to know, because that pushed me forward. That made that decision mine. It was no longer the doctor said I needed to have my arm amputated. It was, I have decided that I want to live, and I have decided that then I will have the surgery to remove the cancer, which will also remove my arm. That just made, I believe, my healing process, my emotional journey, so much easier. It just empowered me, and it has allowed me to be grateful every day that I am still here, that I am still enjoying life, that I have had these years with my grandchildren, with my husband, with my children, with my friends, with my community, and that I'm able to share with you today my journey. So I think a rule of thumb is, if you find a question difficult to ask, or if you're afraid of asking a question because you don't know that you want to hear the answer, if it gives you butterflies in your stomach, then it's important to ask. It's important to have those conversations. You need to screw up your courage and go ahead and say those sorts of things, start those conversations. So, during the appointment, then, you'll talk about the treatment plan, what it is that is recommended. And if it's a test or procedure, then you ask, what do I do to prepare? How will it be done? When will I get the results? How will it make me feel? What will I do with results? Can I have some written instructions? And that's important to be prepared well ahead of time so that you're not surprised. And so that procedure or that test can be maybe a little bit easier. And during the appointment, you'll also likely talk about prescriptions. So it's really important that you understand the instructions for taking those prescriptions. Again, ask for written instructions. Have a thorough conversation with your pharmacist. Be sure that you understand when it says take 2 a day, does that mean 2 pills at the same time, or 2 pills, spread, 12 hours apart? That's really important, especially if it's the instructions is take 4 per day. Do you take them all at once? Do you take them every 4 hours through the night, or just during waking hours? Instructions for dosages are very important. Also, be sure that you understand if it's liquid. If it says a teaspoon, a true teaspoon is different from the kitchen teaspoon. So make sure that you have the proper kind of dosing utensils as well. Ask for written instructions about any side effects that you should look for. How will it make you feel? When should you call your pharmacist or your healthcare team if you do experience side effects? When do you know that, this is just minor, or no, this is serious and I need to call my healthcare team? After the appointment, be sure that you follow any instructions of your healthcare team. If you don't understand anything, be sure to ask. That's throughout this whole scenario. If you don't understand, please ask. That's important. If you have questions, be sure that you ask. Those are always good bits of wisdom to follow, as well as always having an advocate there helping you, being there present with you, being another set of eyes and ears. If you need to make any follow-up appointments, do that. And be sure you discuss with your healthcare team before you discontinue any medication, and call the clinic to get your test results. Don't anticipate that, they'll call me if it's bad news. Things happen, things fall through the cracks. Don't anticipate, no news is good news, unless they specifically tell you that. If they say you won't hear from us, if there's no problems, then fine. But otherwise, be sure that you know the results of your tests. So here are some resources. Again, probably the most important one that I want to recommend to you is AHRQ Question Builder. I don't think that you will in any way regret downloading that and using that thoroughly. Again, communication is vital, and everyone on your healthcare team wants you to understand what's going on, wants to have your input, wants to have conversations, thorough, in-depth conversations with you. So don't be afraid to raise those questions, to bring forward resources, to make sure that you understand as well as they understand you, and as well as talking about your needs and your desires, whether or not you want to seek help from perhaps other members of a healthcare team, like a mental health practitioner or a nutritionist. Those sorts of things, it's your health, it's your life, it's your body, and you have the right to ask for those kinds of extra auxiliary help. So good luck, good health, Godspeed, and stay healthy.